Okay. Hi guys, we are going to have an overview about the USMLE step examinations. Okay. So first I'll talk about how to prepare for the step 1 and step 2 examinations and your step 3 examinations and when it has to be done. Okay. The timeline about the USMLE examinations. So usually because the step 1 concepts are the first and second year concepts, that is everything from the basics of your anatomy, physiology, biochemistry, and even your path, farm, micro, and it's not going to have that much of forensic medicine, the path farm micro, and it's going to have a little bit of clinical concept that's going to be involved. So that's why it's usually given after the first and second year. Okay, so it's not necessary that we should give only during the second year or the third year. We can also give it after the MBBS or even after the internship also. That's your step 1 examinations. So once you are finishing your step 1 examinations, you can go ahead for the step 2 examinations because most of the concepts of step 1 is going to be repeated for your step 2 examinations, which is basically the questions that's going to be asked are about the next step of management. Okay, so they question about the management, that is how to go ahead with a clinical course of treatment. Okay, so for that we need the step 1 core clinical knowledge, so it's better to give after the step 1 examination. So after the step 2 you can directly apply for your residency interview matching, that is during the month of September. Okay, so the whole preparation time for every student is going to vary. For step 1 examinations it can take approximately 6 months. Okay, and some people also take 1 year. Okay, some people also finish it in 4 months, 3 months to 4 months. Okay, so step 1 examination is going to take, let's say, a maximum of 6 months to 1 year, and then you are going to go for your step 2 examinations, and then only you can apply after the ECFMG certification. Then you can apply for the September interviews. Okay, so some students do give the step 3 examinations before the interview applying, and some students finish it during their residency. It's completely their own choice. It's about the ranking procedure basically increases when you finish your step 3 examinations. Okay, so now let's go about a clinical concept. So the condition that's basically given here is carcinoid syndrome. Okay. So what we're trying to see here is a patient who's having a carcinoid tumor. Any tumor, we have to know where the origin is coming from. Okay. Any tumor, we have to know where the origin is coming from. So it's a neuroendocrine tumor. So it is coming from the neuroendocrine cells. Okay. So these cells are positive for chromogranin A and synaptophysin positive. So what is the knowledge that we have to take away from here? The tumor that's coming from the neuroendocrine cells, which can be your carcinoid tumor, or it can also be, for example, the other tumor that we can have is your craniopharyngioma. Okay, so your craniopharyngioma. So craniopharyngioma and your carcinoid tumors, so both are going to be coming from your neuroendocrine cells. So therefore, they are chromogranin and synaptophysin positive. Okay. So next is, what are they going to secrete? What are they going to secrete? So these are going to secrete your 5-HT, that is your 5-HT3, that is your serotonin. Okay. So because you're secreting the serotonin, so let's consider all the vasoactive substances are being secreted, the neurotransmitters are being secreted. That's why they're actually having the flushing as your symptom. Okay. So as you can notice in this particular picture, the patient is have a flushing here. Okay, so that is because of the secretion of your serotonin. Okay, so next symptom is diarrhea, that is also because of your serotonin. Okay, so wheezing is because of the histamine. The wheezing is because of the histamine. Okay, so now why are they having a right-sided valvular heart disease and not a left-sided valvular heart disease? Is because the patients are having the monoamine oxidase, which is going to break down your serotonin into your 5-hydroxyindole acetic acid, into your 5-hydroxyindole acetic acid. So therefore, all the blood that's going to come to the right side of the heart is going to be more exposed to the serotonin exposed blood. Okay, so that's why we're having a more amount of possibility to have a valvular heart disease in the right side of the heart. But in the left side of the heart, because there is a monoamine oxidase that's going to break down your serotonin into the byproducts, they are not going to have a valvular heart disease lesion. So why is it causing a valvular heart disease lesion? So serotonin is usually known to cause fibrosis of the endocardium. So now let's consider that this is causing fibrosis of the endocardium. It's very thickened. Okay. So now we have the papillary muscles, and then we have the chorda tendineae. Okay. So these chorda tendineae, and then we're going to have the wall. Okay. So when these are all thickened, okay, the closing of the walls is not going to be easy. Okay, the closing of the walls is going to be difficult. So that's why the patients are having a regurgitation. Okay, regurgitation. So now what do we have to know? That a patient who's coming with a carcinoid tumor, which is coming from the neuroendocrine cell, if they are presenting like a cardiac complaint, because they are very commonly seen in the intestine and the lung, but I can also give you a serious case scenario where a patient is coming with a murmur which is increasing with your inspiration. So that's going to be classical about your tricuspid regurgitation. So both the tricuspid wall, which is between your right atrium and right ventricle, and your pulmonic wall between your right ventricle and your pulmonary trunk. Okay, so and your pulmonary trunk is basically in the right side of the heart. Okay, so now what do we take away from that? So each and every symptom, we have to know why it is happening. So the flushing and the diarrhea and the wheezing is because of the substance that is secreted by your tumor, and also the valvular heart disease is because of the same. So why is a patient having niacin deficiency or pellagra when they're having a carcinoid tumor? So both your serotonin and your niacin is going to be coming from your precursor, that is your tryptophan. So when your serotonin is going to be using up your tryptophan, the patients do not have much of niacin stores to be produced. They don't have much of tryptophan stores to produce your niacin, so they don't have much of niacin. So that's why they're having a pellagra. So pellagra is all about the D's in the symptoms. You have to remember that. So as I told you, the serotonin is going to be broken down into your 5-hydroxy-indole acetic acid. Okay, your serotonin is going to be broken down into 5-hydroxy-indole acetic acid. So this is a breakdown product. So this breakdown product, they can give you as a full form in the questions, and we still have to know. Okay, so histologically, the two factors that we already know is that because of their neuroendocrine cells, they are chromogranin A positive and they are synaptophysin positive. Okay, so now another takeaway is that in this picture, you're seeing rosettes. Okay, so this prominent small blue cells that's basically in a circular pattern that you're seeing as a rosette is a very classical condition of a carcinoid tumor. Okay, so now going ahead, moving on to the treatment. Okay, so how do we remember the treatment? So because it's a tumor, we can go for a resection, and because the tryptophan is what is giving the serotonin, we can actually go for tryptophan inhibitor, tryptophan hydroxylase inhibitor, that is your telotristat, that is for the control of all the symptoms that they're actually coming with. Okay, even though it's a tumor that's commonly seen in the intestine and lung, only the common ones is mentioned here. They can present with the other system presentations also. Okay, so next is we can also give somatostatin analog, because somatostatin is known to inhibit the majority of the regulatory substances and the neurotransmitters. Okay, so the rule of thirds is basically given here. That is 1/3 of the tumors can metastasize, 1/3 will come with a secondary malignancy, 1/3 is going to be multiple. Okay, so I will talk about this in with respect to the presentation and the pictures also. So the same rosette is what you're able to notice here. I think you guys can appreciate the lesion. Okay, so let's try solving some questions. It's better to stick on to the information given in the first state, because the questions are going to be asking the same exact words in the exam. So now here we are having, always read the question backwards. Okay, which of the following tumor markers would most likely be elevated in this particular patient? Okay, so here we are having a 53-year-old man. Okay, he's coming to the clinic with the presentation of diarrhea for the last 2 weeks, and he's been having a notable for your holosystolic murmur that is best heard in the lower sternal border, and they're also having an enlarged jugular venous wave. Okay, so he's also found to have a GIST tumor. Okay, so now one of the symptoms that we can appreciate is that they have given a diarrhea and they have given the CVS murmur, where the patient can be seen with your right-sided heart, valvular heart condition. Okay, and they also given a jugular venous wave, and the jugular venous wave is usually seen with the right heart symptom. Okay, so now these are all the presentation plus a GI tumor. They have given it's a GIST tumor. Okay, so in this, they're asking what is a tumor marker. So what is the breakdown product of your serotonin? The breakdown product of your serotonin is your 5-HIAA. 5-HIAA is nothing but 5-hydroxy-indole acetic acid. So that is the answer for this particular question. So usually I will put all the MCQ options together so that we can discuss the other options also. So now I want you guys how the question is basically framed and what all are the important aspects that you have to remember for a questionable way. Okay, so which of the following tumor markers would most likely be elevated following lab finding is going to be the most important in this patient. Okay, so here again a patient again saying that the face is very red. Okay, that means it's again flushing. Okay, and he's also having a shortness of breath. Okay, auscultation is showing that there is bilateral wheezing. So this is again a case scenario of your carcinoid tumor, and the lab findings we have already discussed about this, that the patients are going to be having your 5 hydroxy indole acetic acid. Okay, so coming back to the previous topic, okay, previous slide, we are going to have the 5 hydroxy indole acetic acid in the urine, and that's going to be your lab finding. Okay, so now please remember only the points that's basically given in the first state is quite commonly asked as your answers. Okay, so I hope you guys understood the class. Thank you.